Good morning. I'm Peter Kovacs. I'm the editor of The Advocate and the Times-Picayune and NOLA.com, and welcome to our second virtual town hall today from Baton Rouge featuring Senator Bill Cassidy. Senator Cassidy agreed to come over here to our office, and we are complying with all of the safety rules. There's only 4 people in the room, and you and I are 2 of them. And since the senator's a doctor, I feel like if he's comfortable being here, I should be comfortable being here. Today's town hall, Humana is proud to participate in bringing you today's town hall. And before we talk to Senator Cassidy about the stimulus and the coronavirus crisis, and mostly feed him your questions, I thought we'd hear from Matt Berger, who is Humana's Gulf States president.
Hi, everybody. This is Matt Berger. I'm the region president for Humana Gulf States. I'm excited to be here to introduce you to Dr. and Senator Bill Cassidy, who will be talking with you guys on coronavirus-related issues. Humana has deep roots in Louisiana, and our top priority is the health and well-being of our members and everyone in the state. We serve more than 430,000 members in plans across all 64 parishes, and we've served Louisiana since 1985. During this health crisis, Humana has taken action, and we are uniquely positioned to help our members. We're helping to ease burden on seniors and others who are struggling. No Louisianian should be concerned about the cost of health care when being treated for coronavirus. We're responded to COVID-19 through Humana's bold goal. This strategy includes improving the health of Louisianians. We're supporting local food banks and local nonprofits focused on food insecurity in both Baton Rouge and in New Orleans. Let me talk to you about a few steps that Humana has taken to care for our members in response to the coronavirus. Humana is waiving consumer costs for treatment related to COVID-19 services for both in-network and out-of-network providers. We are covering the member responsibility under the plan benefit for COVID-19 related to services, whether treatment is delivered by in-network or out-of-network providers. Costs related to subsequent treatment for COVID-19, including inpatient hospital admissions, will be waived for enrollees of Medicare Advantage plans, fully insured commercial members, Medicare supplement plans, and Medicaid. Humana is committed to supporting clinicians by providing practical solutions to help remove administrative burden during these extraordinary times. Humana is implementing simplified and expedited claims processing and expanding its policy of suspending prior authorizations and referral requirements, instead requesting notification within 24 hours of inpatient and outpatient care. We have an overall effort to accelerate and stabilize access to care for our members affected by COVID-19. Humana is also lifting administrative requirements for members infected with coronavirus and for all patients in settings where capacity is stretched by the need of those infected by the coronavirus. This change allows for the unencumbered movement from inpatient hospitals to safe, medically appropriate post-acute care settings, such as home health, long-term acute care hospitals, skilled nursing facilities, and things of the like. For telehealth services, we are waiving member cost share for all telehealth services delivered by participating in-network providers and accepting audio-only telephone visits for reimbursement. On prescriptions, Humana is allowing early prescription refills so members can prepare for extended supply needs, an extra 30 or 90-day supply as appropriate. We also have a member support line with specially trained call center employees to help support members with specific coronavirus questions and concerns, including live assistance with telehealth. Members can call Humana's toll-free customer support line, which can be found on the back of your Humana member ID card, to be connected with this dedicated team of professionals. And even though our local guidance centers and local offices are closed due to the coronavirus, Louisiana agents are still available to assist members and answer their questions. For more information, members can visit www.humana.com. At this point, I'd like to turn it over to Senator Bill Cassidy. Thank you.
I'll give you a suggestion.
Thank you. I think maybe we'll start with the senator maybe just discussing from the 30,000-foot level the stimulus bill and what's in it and how it will benefit Louisiana.
Hey, thank you, Peter. And believe me, our goal is to get information out to the people of Louisiana. So if we don't answer questions today, I'll say it later, but I'll say it now. You can go to my website, cassidy.senate.gov, cassidy.senate.gov, and there's going to be a little red ribbon at the top of our website. Click on it. It'll bring you to information that you need from the CARES Act, which is both for the small business person, for the individual, for the family, as well as many other things. So please log on. Let me hit some high points though. Folks have heard about the checks going out. $1,200 for an individual earning less than $75,000 a year, $2,400 for a couple making less than $150,000 a year, $500 per child. And it's kind of added on, so it phases out for a head of household a little bit above those amounts I just gave. Those who will receive their checks first are those who file their taxes online and receive their refund electronically deposited directly into their bank account. They will get their check, we're told, within 3 weeks. Similarly, for people who are receiving Social Security benefits, retirees, fought for that. We know that retirees are also being hit by this tremendously. For the retirees to similarly receive, and if you're getting direct deposit, you'll get it sooner, not later. The group that I want to speak to in particular, there are some folks who did not file income taxes last year, presumably they didn't have any income, and who did not receive a Social Security check. You need to go to the irs.gov website, irs.gov. There'll be a place to click to file an amended return. And you go on there, you put your name, Social Security number, your address, and that your income was 0 for 2019. That lets the IRS know where you are. So then they can cut you a check. Now that said, obviously that's going to take some processing. Yours probably won't be here in 3 weeks, but you will be in line to receive. The second group I wish to speak to are small businesses. And under the definition we included for small businesses, it was your traditional small business, your 501c3. So think your local church or food bank or environmental organization, as well as gig employees. I had a call from New Orleans on a telephone town hall, a woman who had invested and created an Airbnb, and now she doesn't have any clients. She would be considered a small business person, even though she is a sole proprietor. And there are forms, you can get them on my website, on the SBA website, also through your local lender. And you can file, you can borrow up to 2.5 times your average monthly payroll. Now, a small business typically is 500 employees or less. So you can borrow up to 2.5 times your average monthly payroll. The degree that you use that money to keep people on your payroll, paying their wages, for your mortgage or for your rent or for your utilities, if you use it for payroll, rent, utilities, mortgage, it will be forgiven as a grant, which is to say you don't have to pay it back as a loan. So 2.5 times your average monthly payroll. We're trying to help businesses and individuals through this rough patch until these stay-at-home orders are eased. You go back to work, and as you go back to work, you're kind of positioned to keep on going. I know we'll go more, but I'll just start with that because I find those are the most commonly asked questions.
Okay, well, thank you. I'm just going to read you questions that we've received, we received a lot of questions. I was happy to say that the questions were respectful, and most people
I'm happy about that too.
Most people have put politics aside. I know you're in a campaign, but there'll be plenty of time for that. So most of the questions are either about the stimulus or sort of medical related to the crisis. I guess the first one is John from Baton Rouge says, I think I had COVID-19 and recovered, but I was not hospitalized or tested. Can I get an antibody test to verify this? If true, I would like to donate my serum to a cure, which is very civic-minded of him.
John, amen, brother. Mm-hmm. So one thing as a physician, when I worked at Earl K. Long Hospital, the charity hospital system for those folks who are not from Baton Rouge, I did a lot of immunization work, a lot of public health programs. And your point is on point, which is that after someone's been infected with a virus, typically they have an antibody response, and this antibody neutralizes a future exposure to the same virus. That is the principle behind immunization. The immunization, if you will, the vaccine, whatever you're vaccinated for, imitates a naturally occurring infection. So, if you've been naturally infected and have cleared the virus, then quite likely, most likely, you have what is called a neutralizing antibody, which then, if you're re-exposed, attacks the virus, boom, kills it, and it no longer infects you. Now, John comprehends this, but I'm just saying that for those, just to give context for the question. To your point, are there places where you could go and donate plasma? They would take those antibodies from you and use it for the gravely ill. It is my understanding that LSU Health Science Center New Orleans is embarking on such a study, as are other places around the country. I don't know that that LSU Shreveport is not, or that Tulane is not. They might be as well, and I'll check on that and put it on our website. But I do know that LSU New Orleans, HSC New Orleans, was considering doing that. Now, as regards the antibody test, they are rolling out now. Abbott has one which they're going to begin to release. They hope to ramp this up quickly as part of a nationwide strategy by which we would know who's been exposed and kind of give you that certificate. Hey, listen, I've been exposed. I'm immune. Once you're immune, if you're a nurse's aide or a nurse, you could go back to work not having to wear personal protective equipment when you go into care for the patient because you're immune, and for a routine patient. And you wouldn't be infected and you wouldn't infect them. It's part of the way we begin to reopen our economy. Short answer, the antibody tests are rolling out now. LSU Health Science Center New Orleans is doing this. I think Tulane and Shreveport probably are, but we'll get you that information. And it's part of our national strategy by which we reopen the economy, by which to figure out who is immune, and in so doing allow them to, again, begin to matriculate.
Okay, well, thank you. This is from Tara in New Orleans, who writes, how will rideshare drivers be recognized and compensated? In 2019, I completed over 3,000 rides in the New Orleans area. For tourists and travelers, I'm an unofficial ambassador for the city that I madly love, giving recommendations for their enjoyment and warnings about safety. I'm incredibly disappointed with the lack of response for unemployment benefits and too many unknowns.
Hey, Tara, believe me, I'm aware that the gig economy is part and parcel of our modern economy, and the CARES Act specifically addresses that. Presuming that you are filing income taxes, you can file for an SBA loan as a sole proprietor, if you wish. You can also, if you don't wish to do that, file for unemployment. The unemployment benefit that is included in the CARES Act is a $600 additional payment to the state's unemployment check they would give you. By the way, in times past, gig employees, if you will, gig workers, would not have qualified for either an SBA loan or for unemployment. Under the CARES Act, they do. You choose the one in which you wish to go. So you're specifically cared for. If you need more information on this, go to our website, cassidy.senate.gov. If you don't find the information there specific, leave a message and we'll get back to you. And by the way, thanks for being an ambassador. Thanks for being an ambassador.
Okay. This is from Bo, who is a doctor. He says, how is the stimulus bill going to help physicians in private practice that had to limit patients due to eliminating elective procedures?
Yeah, great question, Bo. We've been working with that. Two things about that. Healthcare groups are small businesses. They can apply through the Small Business Administration practice, if you will, and to the degree to which you keep your nurses, your clerks, et cetera, on payroll, that money will be forgiven, as I said earlier, as a grant, which is to say you do not need to pay it back as a loan, number one. Number two, a lot of physicians have invested in things like ambulatory surgical centers or physician-owned hospitals. CMS put out a ruling that these facilities could be used in conjunction with a general hospital for overflow and be compensated for that and receive payment from Medicare for that. So if you will, it continues cash flow in your facility even if you're not doing the patients that you normally would be. Number three, One thing that I will be pushing for is that we begin to allow reopening. I'm hearing of chronic pain patients who are having a terrible time because they can't get their chronic pain addressed. I'm a gastroenterologist. I would rather the GI bleeder, the stable GI bleeder, be managed in an ambulatory surgical center as opposed to going to an overcrowded, lots of COVID patients emergency room. So ideally, we begin to divert those sorts of patients to the ASC. There's cancer patients who need their chemo. I could go down the list. A physician told me of his wife needing Mohs surgery. That's a surgery for skin cancer. Now, you can imagine, maybe it's not emergent, but you don't want to sit on it for a long time. So I think we can begin to reopen the medical facilities as long as everybody is taking precautions. We're pushing for that.
Okay, interesting. Here's another question. With Social Security offices closed and there are limited options for seniors who are making 65 to enroll in their Medicare plans, will there be an option for a special election period, which is what has happened in the past with disasters?
I'm sure there will be. I will say, the fact that you're asking a question online tells me that you're online, and that if you're unable to apply for either Medicare or social on the online process, let my office know. That's like 101 in a remote working environment. You should be able to apply online. If not, let us know, and we will speak to the Medicare office and the Social Security office to help you process your claim. We have folks at our office who are able to address this. By the way, the woman that works on Medicare and social is in our Baton Rouge office. Her number, 225-929-7711, 225-929-7711. Her name is Dale. She's probably watching thinking, oh my gosh, but she's there to serve. She does a fantastic job. And so just call, leave a message, we'll get back to you if you're having a problem getting your benefits, getting signed up.
Well, this is from Donna, who is a public-spirited person in Baton Rouge, and this is, I guess, a question on the opposite side of the Social Security question. She says, I am a Social Security retiree, but would like to know why SS1, SS2, and disability recipients are in line to receive stimulus, as we lost nothing and there are few stores open to spend it.
Yeah, hey, Donna, I totally get that. And your situation is obviously a good situation. I'll contrast that with some of the public employees, for example. My old civics teacher, who might be watching this, she taught for many years, but because of something, for example, called the windfall elimination provision, by which people in the state public retirement system receive dramatically fewer Social Security benefits. She's always struggling to make ends meet. And she might get support from her family, but now her family's having a harder time. And so there are subsets of folks who are just struggling. They're having to pay people to go grocery shopping for them. They don't have a car. They've been told to stay at home. They have diabetes and hypertension. They don't feel comfortable going out. So they're having to pay people to do errands for them that otherwise they would not. It might be, in fact, it's going to be, that some of what we're doing now, we don't need to do. But most of what we're doing now, we are going to have to do if we're going to keep people in a good shape going through this rough patch. Thank you for your public spiritedness. By the way, if you are receiving some funds that maybe you don't think you need, there are so many groups out there. The Salvation Army, for example, providing care for the homeless. There's a guy up in Monroe, Captain Jerry. He is making sure that the children of the homeless mothers are still getting school. And I'm sure that's true of every situation. I've been to the one in Shreveport. So there are homeless shelters right now that are really struggling, except for the generosity of fellow Americans. So consider that as we care for each other. We're in this together, and folks like the Salvation Army are those making sure that as we are in it together, that all do as well as they possibly can.
Okay, let me ask you a couple of doctory questions, drawing on your past employment. As a charity hospital doctor, what did you make of the startling, at least to us, racial differences among deaths and infections here in Louisiana, and I know in other places as well.
So what you're seeing now, the people who are, let me start over. For just a second, I'm going to be the medical school teacher that I was for 25 years. When the virus comes into our system, it has to attach to something to get incorporated. If you think about it, typically when you eat something which is wasteful, we let it go out the other end. Except this virus has a way to attach and to get inside our body. Now the attachment is to something called an ACE2 receptor. An ACE, ACE, an ACE2 receptor. It attaches to that ACE2 receptor, gets inside the body, spreads throughout the body, and when it finds other ACE2 receptors, it clicks on them and gets incorporated and causes the damage. There are some conditions which increase the number of ACE2 receptors that we have in our body. Obesity, diabetes, high blood pressure. Those conditions particularly increase the number of ACE2 receptors in our body, which means there's no more places for that virus to enter, boom, cause damage. As it turns out, African Americans have a higher, I think a 60% incidence of diabetes, a 47% incidence of hypertension, and a greater degree of obesity than do non-African Americans. So I think what we're seeing, if you controlled for obesity, diabetes, and high blood pressure, the racial differences would not be as great. By the way, this is not to minimize racial disparity, but this is to seek a scientific understanding of it. And also, I'm also telling people, by the way, that tells you who should be more careful, regardless of your race. If you have high blood pressure, diabetes, or obesity, you go to the store, you definitely need to wear a mask. You definitely need to be very conscious of washing your hands, of wiping down surfaces before you sit. By the way, everything we're on was wiped down with a Lysol wipe before we sat down. And it also tells us, going forward, ideally, since COVID's going to be with us for a while, we begin to address the issues of diabetes, high blood pressure, and obesity in our society. Doing so will decrease the risk of COVID-19 complications for African Americans, but also for everybody.
Okay. Well, let me follow up on that with a question. Were you surprised when the statistics started coming out, or did you suspect it based on
Totally
your experience?
predictable.
Really?
In fact, the Chinese, what surprised me is when I first was reading the Chinese data, because I've been reading the Chinese doctors, the Chinese government has been awful, the Chinese doctors have been fantastic. The Chinese scientists and the Chinese doctors are constantly publishing things that are helping us. It's fantastic. Hats off to them, thank you very much. They initially reported that a 50-year-old with hypertension was at high risk of getting severe complications, of dying. I remember thinking, high blood pressure, more so than heart disease, more so than lung disease, didn't make sense to me. Now it does. Those Chinese hypertensives had more ACE2 receptors, and therefore the virus had an easier time. So it continues to be an issue wherever you are in the country. It's just that if you're in a population which has more ACE inhibitors, more ACE2 receptors, because of diabetes or whatever, you're going to have a bigger problem.
Oh, okay, that's interesting. One other sort of medical question. One of the ferocities of this virus is the fact that it transmits so easily. And we're wiping down things in this building, and I assume you're doing that at home. But how long, if I touch this table or if I touch this bottle of disinfectant, how long does the virus live if you don't do anything to clean it up?
So potentially as long as 72 hours on plastic and on stainless steel. And so this potentially 72 hours.
Okay.
Now that depends. And it kind of depends on what you know it would depend upon. If it's a little bit of spit that quickly dries, not very long. If I sneeze and it's a big glob of snot that has a lot of moisture in it, one, it has more virus in it, but two, it has the moisture to kind of keep it alive. By the way, let's talk a little bit about this. The virus is not a bacteria, so antibacterial soap doesn't necessarily help. But the way it kind of is constructed, it has a little bit of rim of fat around it. And the reason that washing hands is important for 20 seconds, and by the way, 20 seconds, if you sing happy birthday to Peter, happy birthday to Peter, happy birthday dear Peter, happy birthday to you, that's 20 seconds. So
It's
you
not my
want,
birthday, but
it's not his birthday, but still. So I have my grandson sing happy birthday to Sam. And so if you do that for 20 seconds, the soap will destroy the fat lining around the virus. If you have hand sanitizer, but that is 70% alcohol, the 70% alcohol dissolves the fat lining. So the Lysol or the Clorox destroys the fat lining. Hot water is more likely to melt that fat lining. So everything we're doing to disinfect relates to that fat lining around the virus.
okay. And if we melt the fat lining, the virus is killed
Boom.
because it doesn't have its protective
Correct.
lining. Okay, all right. Well, that's
Or if it dries out.
okay.
If it dries out, once it dries out, it just melts away.
Oh, okay. Getting back to some stimulus questions, Lane from Slidell says, my son is a 22-year-old full-time college student who works part-time and pays taxes. We claim him as a dependent. Will he receive a stimulus check?
He will not receive a stimulus check. He will get a $500, you will get a $500 check because you claim him as a dependent, which obviously you can pass on. And depending on the nature of his work, he could also, again, if he's a 1099 employee, he could file for unemployment, or he could potentially file as a small business person if he's like, if he's like Tara was earlier, an Uber or a Lyft driver. But in terms of the stimulus check, it's $500 going through you.
Okay. Addis from Wagaman says, what do you do if you have a different bank account since you filed your taxes last year? Like, how do you tell the government?
Yeah, you
where
should
to
be able
send
to
your
do
money?
the amended return and just file on irs.gov and let them know. If you have a problem with that, contact our office, website cassidy.senate.gov, cassidy.senate.gov, or you can call, again, our Baton Rouge office is where we have our caseworkers, 225-929-7711. Leave a message, they'll get back to you. 929-711, area code 225.
Okay, thank you. This is from Christopher of Baton Rouge, and he asks, is the stimulus check considered taxable income
No.
for 2020?
It is not.
Okay, that was a simple answer. This is from Paul in Metairie. Why did you spend $300 million of my fellow Americans' money for foreign migrants and $25 million for the Kennedy Center?
So the Kennedy Center, now, the payments for the foreign migrants, if somebody is here as a permanent visa, a green card, for example, paying taxes, then they qualify, as does a U.S. citizen. That might be the doctor who's been there for 30 years. He's never gotten citizenship for whatever reason, but he has still paid taxes for 30 years. In terms of the Kennedy Center, we had a deal in which it had been worked out on a bipartisan basis. And now I'm just giving you politics, and you could read it in the paper if you wanted to. If I sound partisan, read it in the Washington Post or the Advocate. Nancy Pelosi came in and put the brakes on and said they wanted more. Initially, they asked for $25 billion for the Postal Service, $75 million for the Kennedy Center. They wanted Green New Deal provisions. I can go down the list. They delayed passage of the final bill by 4 days because of this. At the end, just to get the bill out, the $75 million for the Kennedy Center was reduced to $25 million. The money for the Postal Service went out. The Green New Deal stuff went out. But that was all because of Pelosi and Schumer deciding that they wanted to extract a little bit more.
So some people have asked whether the second stimulus might repeal some of that.
Repeal some of what?
Some of the $25 million for the Kennedy Center, which I think laid people off after that.
Yeah, they laid people off. So No, in fact, that's Schumer and Pelosi have different ideas still. Again, it's in the news today. So go to Advocate Online, which, by the way, y'all have been making your coronavirus content free. I've subscribed to it. My office subscribes to it. I thank you, and by the way, if you're not, I'm just going to put in a plug for a newspaper, which I think is frankly fairly unfair to me most of the time. But we need a vital fourth estate, and I thank you for making the coronavirus stuff. And I say that because, by the way, every now and then I'm thinking, what in the hell are you writing with this for? But nonetheless, I'm just going to say thank you for making your coronavirus stuff available. I appreciate that.
Okay, well, I appreciate you saying that.
But going back to the question, the amount of money going to small businesses and charities, 501c3s, has been greatly subscribed to. They anticipate the fund will run out. To address this, the administration and Leader McConnell, the Republican senator from Kentucky, the head of the Senate, proposed putting up more money to help address the small businesses. Again, people like Tara, who is a 1099 employee, as well as the charities, et cetera. And they thought that we were going to be able to do this, but Pelosi and Schumer are objecting, and they want special things involved. We'll see where the negotiation goes. They're putting a limit on our ability to get that money out as they seek to use this for political advantage to get other things addressed. They are not going to take back the money for the Kennedy Center. They want more money for things that they have a particular interest in.
So you might be in favor of it, but in the back and forth of bargaining the deal, it's not probably coming out.
What's that?
You might choose to remove the Kennedy
Correct.
Center money, but in the back and forth of having
it's
to
not
get
gonna
enough
happen.
votes, that's not going to happen. Cheryl from Ponchatoula says, are we going to put a sanction on China for releasing the virus?
So we have a limited ability to sanction China. I mean, folks want us to go after China. I'm thinking, how do we go after China? But I can tell you one thing that's going to happen. What has been clearly exposed is the vulnerability of our supply chains for drugs, personal protective equipment, and other things, because so much of that has been placed in China and in India. So China, for example, makes what are called active pharmaceutical ingredients. This is what we need to make our drugs. They are shipped to China and put inside the capsules, and then it comes to us. China stopped producing them, and so India embargoed shipment of drugs to our country. I'm going to start pushing, and have already, that that supply chain be relocated back to the United States. Yeah, we can keep some of it over there, but we better have a self-sufficient supply, because if ever there's another outbreak, or maybe tensions with one of those countries or any country, we want to have the ability to produce our own and not be dependent upon those other countries who have just shown us that they will cut off their supplies to us if that is in their national interest. So I don't know if we can sanction them directly, but we're going to start pulling back those supply chains. Helps our economy, hurts them a little bit.
So how would that work? I mean, you know, most companies that make a product are going to choose to make it in the cheapest place and way possible. And so in order to get them to manufacture in the United States, which typically costs more, you know, how are you going to get that to happen?
There's a couple ways that you could do that. For example, we have under the George W. Bush administration, and Bush, by the way, anticipated this pandemic and put in all the programs and procedures that we're now using to address this. He read John Barry's book, and I know you know John Barry.
I do.
On the Spanish, John lives in New Orleans, and he's written several things, The Rising Tide, about the Great Flood of 1927.
Yes, he did.
But he also wrote a book about the Spanish flu epidemic of 1917. George W. Bush read it, and that's when he began to push addressing the issue of a coming pandemic, putting into place that which is important for our response so far. Around that time, we also put in a federal agency called BARDA. Now, BARDA, a bioterrorism something or other, we the taxpayer, own 75% of several vaccine manufacturing facilities that are located in the United States. Normally, the company that owns 25% uses these facilities for the run-of-the-mill vaccines they have to make. If, however, in a national emergency, those facilities are converted to make the vaccines that we need for a national emergency. So if as soon as a vaccine is available to produce for a coronavirus, those are going to be converted to only working on coronavirus. You could do that similarly for certain drug manufacturing, that the federal government, the federal taxpayer would own 75%. If ever there was an emergency that required us to produce our own fill in the blank, hydroxychloroquine, then that could be converted to produce those drugs which we needed specifically for our purpose.
Yeah. Speaking of hydroxychloroquine, is that there was a lot of interest in that and attention to that a week ago. Is that working? It hasn't been in the news as much, so I would have assumed that if it was working, it would have been in the news more, but do you know?
There's different reports about people who are on hydroxychloroquine to treat their other conditions having a lower incidence of coronavirus infection. That suggests that if you're taking it on an ongoing basis, it may give you some protection. I can tell you, Tony Fauci, the head of the NIH, would not accept that as enough evidence to do it. So I'm not recommending that you take it. I'm just reporting the evidence, or what people are taking as evidence. There are some hospitals in which it's now part of their routine protocol that when somebody comes in with an early infection, that they're put on hydroxychloroquine to address that situation. There's a Baton Rouge drug wholesaler, Morris Dixon, a Shreveport drug wholesaler up in Shreveport, Morris Dixon, and they supply a lot of the hospitals and pharmacies in our state. They tell me they have an adequate supply for both the people who need it for their rheumatoid arthritis, but also that might need it for other conditions. So I think we'll see that evolve quickly.
Okay. Do you know which hospitals are doing it in Louisiana?
No, I don't know that, but you know, docs communicate pretty closely, so I'm suspecting these protocols are out there.
Okay. Wayne from Evangeline says, with millions of Americans out of work, why are we importing more immigrants?
So the immigrants that I think are getting work visas are people who, for example, run sugarcane kettles, in which there's really it's seasonal work. They're here for 4 months, and then they leave. And so I'm told that the expertise to run these big kettles to take sugarcane and make it a sugar product is that which is specialized among people that come in for 4 months. Now, I'm just giving an example. I'm not sure they're here right now, but that is an example. To the degree that there's still people coming in, there would be the seasonal produce pickers, folks that go through and pick strawberries for 3 months, and then they move to another location. I'm sure that if somebody wanted to pick strawberries, they probably could go apply for that job and get it. But as a rule, I'm told those farmers have a difficult time getting those workers.
Yeah. This is from James of New Orleans. Will unemployed workers who've been let go and receive their federal benefits, will the federal benefits, the unemployment benefits, be retroactive to the date of the layoff? Or does it just start whenever your form gets processed?
So the way the unemployment benefit goes through is the money is being given to the states, and then the states are then distributing it through their own normal unemployment insurance program. So if you go to the Louisiana workforce, I forget the exact website, but I'm sure the advocate can post it online and we'll post it. But it's where you would normally apply for unemployment benefits. Whatever the criteria are the state of Louisiana has, that will be the criteria by which your benefit is dispensed. The benefit itself, though, is $600 on top of that which you'd ordinarily receive. So that's the federal addition to the benefit you're receiving. But once more, it'll be dispensed as per the state of Louisiana's guidelines.
Okay. Ben of New Orleans says, how is the stimulus being financed? Are you borrowing money that the next generation will have to pay off again?
Great question, Ben. Yes, we are borrowing it. I will say that right now the federal taxpayer is borrowing money at basically 0% interest rates. And so I'm told that the amount required to finance the debt is only about $30 billion a year, even though we're borrowing $2 trillion. And that's the nice thing when you borrow at basically 0%. The second thing to say is the way it's structured is to try and leverage the private sector. So for example, I think there's like $400 to $500 billion going to the Treasury Department, which then gives it to the Federal Reserve. And these are for the larger companies with more than 500 employees. The Federal Reserve then creates a program in which they guarantee loans set up by private banks. Now this leverages anywhere from a 3 to 10 times leverage, so that 500 billion becomes 1.5 trillion to $3 trillion. So there is an outsized effect of the program. This money must be paid back. And so even though it's a $500 billion transfer to the Fed, the money has to be paid back with interest, so that portion of it will be offset by future payments back to the Treasury.
But it is essentially just deficit spending.
It is deficit spending, but it also recognizes that if this is your economy and we go into a depression, so instead of having a GDP of this, we have a GDP of that future tax receipts are going to crater. So we are borrowing to keep the economy afloat, but to the degree that we keep the economy at this level, not this level, our tax receipts will be at this level, not at that level.
Dwight from Baton Rouge says, I work for a small oil production company, was just laid off this week due to oil prices, in other words, kind of not due to the coronavirus, and do I qualify for unemployment in the stimulus package?
Yes, and we have a specific effort we're making on medium-sized oil and gas companies, Dwight. If you think about it, the oil and gas is getting a double hit. There's a price war between the Saudis and the Russians right now, and there's some evidence that at least the Russians are dumping their oil on the world market at below their cost of production. And there's also evidence that the Saudis and others have continued to ramp up their output even as our prices have cratered. Now, I consider this a national security issue. I told my staff today to file 2 bills. One, to put a tariff on foreign oil, and secondly, we should reconsider our security arrangement with the Saudi Arabians. If they are willing to undermine our national security by cratering our oil and gas industry, why are we helping protect their national security? I think that really begs the question. But that said, I'm having a call later on this week with Secretary Mnuchin as to what we can do for small and medium-sized oil and gas companies in particular, recognizing their unique role as contributing to both our economy, but also to our national security. By the way, I also meant to say it's a double hit. It's a price war, but it's also dramatically decreased demand because planes aren't flying internationally. That's 3 million barrels a day not being used for jet fuel. Cars aren't driving. That's another multiple million barrels a day not being used.
Yes, well, this is not exactly good news, but Baton Rouge's traffic problem has been alleviated by this.
You know, you can get across town in 10 minutes.
Yeah, it's pretty startling. This comes from Melissa of Denham Springs. How exactly will this money be classified for purposes of a 2020 tax return? Is it income or is it considered an advance on next year's refund? And if the latter, for those who don't generally receive a refund, what's going to happen to them?
Tax-free.
Okay.
It is not reportable.
So, Courtney from Metairie says, I just received unemployment, which is $247 weekly. Would my unemployment rise by $600 through the stimulus package, and when would that start?
So it will rise by $600 over and above that what you're receiving, but that will be dependent upon what the state does. Again, the Congress gave the money to the state, but it's going to be state guidelines. And this will go for 4 months. So at the end of 4 months, the additional payments through this CARES Act for unemployment ends.
Okay. And separate from that, the $1,200 or $2,400 or whatever it is a one-time
Correct.
payment in April, hopefully?
Correct. Okay. Now, it's possible that there'll be another, but we really hope not.
Yeah.
The only reason there'd be another is if this shutdown continues longer than we think it might. Mm-hmm. Sure, it's nice to get the money, but we don't like the reason why we're getting it.
Okay. Caroline of New Orleans says, will there be financial aid to help parents pay private school tuitions if their incomes have been cut off by layoff? 2
things. No, not over and above the $1,200 or the $500 that's coming in. But secondly, we are, of course, incentivizing small businesses at least to keep their people employed, as well as large businesses to keep their people employed. So hopefully we will mitigate layoffs.
Okay. This is from Christina of New Orleans. Many healthcare workers, including physicians, are not eligible for the 0% loan due to their federal loans being owned by a private lender. What are your plans for, in addition to the current stimulus, to assist healthcare workers who are sacrificing so much right now to save our community?
Oh, yes, Christina. First, let me just say, again, I'm a physician, worked in the charity hospital system. There is a unique role being played by healthcare workers, and some are basically sidelined while others are being overstressed, overstretched, et cetera. So, and to your point, I think the point you're making, if you're looking at a mortgage, for example, right now there is if you have a Freddie Mac or Fannie Mae mortgage, the president has said that there will be no foreclosures if people cannot make their notes if they are in such a situation. But if your mortgage is held by someone that is not Freddie Mac or Fannie Mae, then you theoretically could be foreclosed upon. Now, as regards physicians and nurses in particular, as I mentioned earlier, medical practices do qualify as a small business administration entity, and they can apply for a loan 2.5 times average monthly payroll, and so up to $100,000 reimbursement. So if the nurse is making $90,000, she could continue to receive the entirety of that 90K, prorated, of course, over the period of time. She could continue to receive that. And so hopefully that'll help her continue to make her loans. If it's a bigger concern, most medical groups are not that big, but if it's a hospital, for example, there's going to be $100 billion coming directly for healthcare entities, and that $100 billion is going to be going out soon, and that's to help keep hospitals afloat. Now, folks may say, well, they're all busy with COVID patients. Aren't they keeping afloat anyway? Well, the reality is that you lose money on these types of patients. You make your money on elective cases, and the elective cases are all the ones being canceled. So there will be money coming to hospitals. I ask, and they also are specifically coming to physician groups. So the money will also push out to physician groups as well. We're also allowing small businesses to delay payment of their payroll taxes until the new year. So if you have a quarterly filing of payroll taxes, you can push that off until the next year to try and create liquidity in the interim so that you can kind of keep things afloat. Now, that's not particular for medical practices, but it also applies for medical practices. There's other things as well. Go to our website, cassidy.senate.gov, click on that red ribbon, and there'll be other things that we have in there.
What is happening, since you were a gastroenterologist, what is happening with physicians and medical staff who were specialists?
Yeah,
who were specialists in specialties where presumably only emergency care is being given?
They're being hammered.
Mm-hmm.
They're being hammered. And they've got a cash flow issue because they're trying to keep everybody employed. Mm-hmm. They're trying to make their payments on the facilities that they've invested in. Mm-hmm. That's why one thing I think would be helpful is allowing them to open up to provide this care, which may not be emergent, but it sure is important. Chemotherapy, cancer surgeries, colonoscopies because somebody has a mass in their rectum. I'm sorry, but I'm a gastroenterologist, and if somebody notices that they have blood coming out of their rectum, maybe it's not an emergency, but you sure as heck want to know what's causing it. And that is a real live issue that one of my gastroenterology friends calls me up about. So I do think that we need to start opening up the medical aspect of it as well.
So if a patient had that problem, for example, and you were treating them, the patient might say, on the one hand, this medical problem doesn't seem like a good thing. It seems like it should be addressed. On the other hand, I'm not sure I want to go into a hospital because I don't know whether I'm walking into a center of coronavirus. What would your doctor advice be?
My doctor advice would be to call your personal physician and then your personal physician will try and make an arrangement. Going back to gastroenterology, I spoke to a gastroenterologist in the Metairie area, and they have their ambulatory surgical center, I think, open once a week, just because there's some things you just got to do. And see if you can't make an arrangement where you can be one of those patients who is seen.
I see. So you would recommend that person be seen under those circumstances?
Totally.
Yeah.
I mean, somebody told me of, I won't go into more detail, I have more detail, of someone who was in such severe pain, they committed suicide.
Okay.
Now, we can imagine that. So we've got to recognize that there's not emergent, but by golly, it better be taken care of soon sort of issues, and I think we need to start liberating our economy to do that.
Okay, this is from Tommy in New Orleans, who's a street performer and hasn't filed taxes because he is below the $12,500 line. And so how does that work in terms of...
Oh, man, great question, man.
Okay.
We're thinking of you when we wrote the CARES Act. To answer it more broadly, if you've not received Social Security benefits and you've not filed income tax, then right now the IRS doesn't know you exist. So you can go to the website, irs.gov, irs.gov. There'll be a place to click to file an amended return. And the amended return will allow you to put in your name, your social, your address, and then your income for 2019 or 2018, and presumably it's zero or whatever it is. You don't have to pay taxes, so you didn't file. That lets the IRS know you exist. And once you have that in there, you'll be in line for the check. Will not come as quickly as if they have a record of you already, but it will come. And if you have a problem, contact us. Website, cassidy.senate.gov.
Okay. Nora from New Orleans wants to know, since we really don't know how long this is going to go on, will you advocate for a monthly universal stipend for citizens until the stay-at-home orders have been lifted? And I know the idea of a monthly stipend was the brainchild of one of the Democratic candidates in the presidential election. He didn't win, but that idea seems to have a little more acceptance than it did a few months ago.
Well, I think we really have to see how this plays. One, there's already evidence that the crest of the epidemic is passing, number one. Number two, if the Small Business Administration program successfully encourages small businesses to keep people employed, hopefully, and/or the unemployment insurance successfully keeps people afloat, then effectively we're doing what you're advocating for, is making sure that folks have some guaranteed income. But I'll also say, if at some point in the future it's clear that this is going on longer than we thought, there will be an openness to a second quote-unquote stimulus check. Now, if everybody gets it, it might be the person who has passive income and who's continuing to make more than enough for their circumstances. So Donna earlier, for example, asked, why are people who don't need it getting it? And hats off to Donna for caring. So we have to figure out, how do we target relief? We don't want to spend money just to spend money, but we have to recognize that some people are in dire circumstances, so I think we need to sort that out.
There are also people who say, and there's a theme of that in these questions, that in some cases, the structure of the way the stimulus is written, we're going to pay people more not to work than to work, and so ultimately maybe we're going to want them to come back to work, and they're going to say, well, this is actually pretty cool too.
Yeah, I totally agree with that. And I made that point, and then it got picked up by other Republicans. On a party line vote, Republicans asked to change that. Basically, we don't want to incentivize people to quit work because we need people to work. But on a party line vote, that failed, with Republicans voting to have some reform on a state-by-state basis, and Democrats opposing that.
And what would it have been if your view had prevailed? How would it have worked?
So the way
different
states do differently. But again, as we mentioned earlier, this is going through state unemployment programs. But what some states do is they say you cannot earn more than 2/3 of that which you cannot get from unemployment, more than 2/3 of that which you would be getting if employed. Okay. Now you can imagine that you could make that 3/5. You could increase that, but it would still have some incentive to keep working. By the way, the nice thing about keeping working, two things. One, you keep your benefits. And so it's short-sighted to quit if you lose your benefits. Secondly, it keeps your seniority. And so wherever you are on the seniority, we know that future wages are dependent upon current seniority. And so that's another thing to keep in mind. A third thing, it keeps your skills sharp. And so therefore future wages are dependent upon that. There's a lot of reasons why people should continue to work.
Yeah. So what you would have envisioned would have been that some provision that would have said that $600 is the $600, but if the $600 causes you to make more unemployed than working, that states would not give out the full $600.
Well, what I'd prefer to have done is to allow the state regulations which address that issue to have been allowed to operate.
Okay.
Because states have thought this through. I don't want the federal government telling states how to do their business, but states have thought this through, and I would have allowed that state mechanism to work.
Okay. Sort of the last topic, from your perspective as a senator and your perspective as a doctor, can you talk through what the reentry, whatever it's called, the revival of the economy, the removal of sanctions might look like and when it might happen?
Yeah. So I've been writing about this, had an editorial published in the Wall Street Journal, and have been talking about it on television. I'm glad to talk about it now with the Advocate. One of the callers earlier, Jerry perhaps, spoke about how once exposed to a virus, quite likely we have antibodies that prevent us from being reinfected. We are immune. Now, one thing from my experience doing public health is that when you vaccinate somebody, you can measure their antibody response and you know they're immune. 50% of the people exposed to coronavirus have no symptoms. There's a lot of people out there who have been exposed, they're immune, we don't know it. So the administration and Congress are pushing to have widespread testing so that we know who's actually immune. Next, we also know that children are being hurt by this shutdown. Not because they get sick. Typically, children don't have any symptoms whatsoever. Because they're missing school. Or if they're a young adult, they're having to stay home from college or from work. So I can imagine that you would allow children, young adults to return to life. If they have diabetes, that's one thing. But if they're otherwise healthy, they return to school. You serially measure who is immune. And if I know that Peter is immune, then frankly, I don't have to stay 6 feet from him. If I know that my grandchild is immune, then I can hug him and I don't have to fear that he's been exposed to other kids, he's gotten infected, and he's bringing infection to me. He's immune. So as we begin to know who's immune and who's not, we can begin to liberate society. We can also recognize that younger people are less likely to have symptoms, so they can begin to return to society as well. And we have this kind of mix of people we know at low risk, probably getting infected but having no symptoms, but as they become immune, allowing them to provide services. And then as you and I naturally get immune, we also can provide services freely. At some point, a vaccine becomes available, and with that vaccine, we all get immune.
Yeah. So by this, we would essentially have to test every American, and if I'm immune, I get a wristband, and the wristband enables me to stop social distancing and return to work, or I mean, how could something like that work?
It wouldn't have to be a wristband, but for example, we do this commonly. If you are a nurse in a hospital, the hospital oftentimes requires all employees, doctors, nurses, clerks, etc., to be vaccinated for the flu. So they require immunity. There are some schools that require that all teachers be vaccinated for measles and other vaccine-preventable diseases because they don't want the teacher to pick up the infection from the child. So we already require immunity in certain situations. So it wouldn't be that the advocate could discriminate on whether or not somebody was immune or not. But they would say, if you're working at our front desk, we think it's safer that you be immune, and so therefore when somebody comes in to deliver a package, we would not have to worry about you getting infected. So you may have job descriptions depending upon whether or not somebody's immune.
Okay. All right. Well, thank you very much for coming here today. This was all very well explained, both the politics and the medicine part of it. We are planning to continue this series of town halls, and we have asked the governor to visit with us next week. They have said that they will be glad to do that. We're working on when the time would be. He probably has a pretty busy schedule, so I think it would be hard for him to commit right now. But we appreciate you coming by here today, and let's all of us stay healthy.
And I will say once more, if you have questions, thank the advocate for hosting this. But if you have questions, our website, cassidy.senate.gov, we're there to do casework. And you go to our website and you can find the phone number for the New Orleans Metairie office, for the Baton Rouge office, et cetera. And you can call, leave a message, and somebody will get back to you. But again, be safe. I'll finish by saying what a maintenance worker told me in the Capitol as I was leaving one night. He said, keep your joy. Don't let it get you down. Keep your joy.
Okay, well, thank you very much.
Thank you.